Okay, last but not least, these are the CNS drugs. This is just a smattering of a few of them. There are a lot of them out there. They're used to treat a variety of things. A lot of times the things they're used to treat overlap. Sometimes you're treating anxiety, sometimes you're treating depression, sometimes you're treating, chronic pain. There's a lot of different reasons you give these drugs. But you see a lot of them in the hospital. Anxiety falls into different categories. Somebody can have just a generalized anxiety disorder. They can have flat-out panic disorders and phobias. They can be OCD. They can have post-traumatic stress. So these are people that that anxiety is sort of spread out over a wide assortment of diagnoses. Inability to sleep is the most common symptom associated with an anxiety disorder. The most common cause of an anxiety disorder is just a phobia. People have phobias of, insects or wide open spaces or whatever. And you'll learn more about those in 202. It's actually pretty interesting. But these anxiety disorders can be treated with a lot of different things. They can use anti-anxiety, like benzodiazepines. They can use the antidepressants. They can use lots of different things to treat these. And once again, a lot of times these people that have these problems, they have other issues too, and it all kind of overlaps. So sometimes it's hard to tell exactly why they're using what drug, but we'll talk a little bit about that. Benzodiazepines, these are for short-term anxiety or insomnia disorders. These are the V drugs, Valium, Ativan, Versed. Remember we talked about Romazicon being the antidote to these if they take too much. Xanax is also a benzodiazepine. It can cause dizziness, drowsiness, confusion, low blood pressure. Respiratory depression is a biggie. Dry mouth and GI upset. Respiratory depression you really have to watch for in somebody that you're giving these drugs in the hospital. If they're going into surgery, you may give them some Versed. If they're having a procedure done, if they're having a bone set in the ER or something like that, you may give them some Versed or some Valium or some Ativan IV. You really have to watch that respiratory depression because you can knock out their respiratory drive. These do tend to have some sort of a hangover effect too, so they may have a little bit of trouble waking up. They may be dizzy and drowsy and foggy for a little while because they can cause sort of a hangover or not get out of my system real well in some people, so you just have to be aware of that. Be careful with people that have addictive personalities. You can get addicted to Valium and Xanax and Ativan. People that take a lot of it at home, sometimes they'll have a home prescription and they'll be taking it 3 times a day or whatever, or dosing themselves however often they feel like they need it, and they come into the hospital and all of a sudden you snatch them off of it because the doctor didn't order it. That can cause some rebound anxiety and some problems with these people. So you have to be tuned into that. If you see somebody that you find out they were on a benzodiazepine at home, you need to, keep that in the back of your head because you may need to talk to the doctor about, do we need a PRN order for this person for her anxiety? Because she was obviously taking a lot of this stuff at home. Be aware of geriatric patients. They can have an increase in side effects associated with this, especially the respiratory depression and the confusion. Sometimes you'll use benzodiazepines to treat seizures, like Valium or Ativan IV if somebody's having a seizure. So just be aware of that. Somebody that's got a seizure disorder, you'll need to, of course, make sure that you have that kind of drug on the unit, which you usually do have it in your Pyxis. Because if they have a seizure, a lot of times people will have a respiratory arrest also when they have a seizure because all their muscles clamp down. And if they sustain a seizure for a prolonged period of time, they're not breathing during their seizure, which is, of course, bad. So that's why you have to be sure and get something in their system to try and relax them out so they'll breathe again. Interactions with anti-anxiety drugs are going to be the increased in CNS depression if they're on other medications that cause CNS depression, so you have to consider that. If somebody is on an opiate and they're also on a benzodiazepine, they can have an increase in CNS depression. Food or milk will help decrease the GI upset. You may have to decrease opiates during the therapy for the side effects reasons. These people don't need to drive or operate heavy machines. If they come in the ER and you give them a dose of Xanax for acute anxiety, or you give them a dose of Versed to try and set their arm because they broke their arm or whatever, then these people don't need to drive home or don't need to go back to work if they're going to be doing something where they're operating heavy machinery. So that's, I mean, that's obvious. But avoid alcohol because it potentiates the side effects. Don't stop a therapy abruptly. Once again, this little person has been on Xanax 3 times a day when they come in the hospital, and all of a sudden you yank them off of it, you're going to have problems. You're going to need to put them on some sort of a low dose to keep them from having problems. Antidepressants are drugs we give to enhance the mood by boosting the circulation of the norepinephrine or the serotonin. There's different types of antidepressants. The tricyclic antidepressants would be something like Elavil. The SSRIs are the selective serotonin reuptake inhibitors. You see that pretty commonly now. That is the like the Prozac and that kind of thing. The monoamine oxidase inhibitors are used to be used a long time ago. You don't use those very much anymore. The MAOIs you just don't use much anymore. They have a lot of interactions with other substances like medications and things. So you don't see those used except for in a last-ditch effort. But there are some people that are still on them out there, I'm sure. The tricyclic antidepressants are used for depression, also OCD or panic disorder. The ones, again, this is like Elavil. I've seen this used for people that have chronic pain or chronic anxiety. I've seen this used for a lot of different reasons, but it tends to make people a little overly sedated when they first start taking it. It takes a while to kick in. So usually people need to take it at night, and they may get some hypotension, some sedation with it, but that you try to tell the people, you know, you're to expect that. And it's my understanding it gets somewhat better when you've been on a routine dose for a little while, a few weeks. The sedation part gets a little bit better, but that's the most common thing I've heard patients complain about with the Elavil. It's not usually the first line of treatment. You'll give them an SSRI or something usually first. So, anticholinergic effects. There's a lot of different reasons why anticholinergic drugs are used. The anticholinergic drugs are the ones that block the acetylcholine in the parasympathetic system. So when you go through nursing school, you'll come across a lot of anticholinergic drugs. And I usually think about the side effects of the anticholinergic drugs. There's a little mnemonic or whatever that says you can't see, you can't spit, you can't pee, and you can't poop. So you hear that a lot. You can't see, you can't spit, you can't pee, you can't poop. And because they can cause blurred vision, they can cause dry mouth, they can cause urinary retention, and they can cause constipation. So that's what that means. You can't see, you can't spit, you can't pee, you can't poop. They get blurred vision, dry mouth, urinary retention, and constipation. So the anticholinergics cause all those things. And you'll learn about anticholinergics as you go through nursing school. You'll come across a lot of different reasons that people use anticholinergics. Nursing considerations with the tricyclic antidepressants. Don't stop it abruptly. It may take several weeks to kick in. Monitor for the anticholinergic stuff and be careful with driving until you know how the patient's going to react because of the sedation. The SSRIs, this is Zoloft, Prozac, there's several of them out there right now. They are used as antidepressants typically. They increase the heart rate. They can increase the heart rate. They can give you high blood pressure. They can have the anticholinergic side effects. They can give you headaches. And biggie is they can cause insomnia. Sometimes people have trouble with insomnia when they take these. So it's best to give it in the morning because you don't want patients to have insomnia with that. And once again, with the SSRIs, don't stop taking them abruptly. They need to be tapered off of those. Tell your patient it may take several weeks to kick in. So don't, expect to have your depression cured tomorrow by your SSRIs. It's going to take a little while to kick in. Be patient with it. Monitor for those anticholinergic effects, the dry mouth and the blurred vision, so on and so forth. And once again, be careful with driving until you know how the patient's going to react. All right, that is the end of the CNS drugs.